Welcome to AJ Plastic Surgery Center. Today we are going to talk about man boobs, also referred to as gynecomastia. This is a condition that afflicts men where they have, from the word gynecomastia, they have breasts that have feminine or have features of female. It usually affects two age groups. You have the post-pubertal, just after puberty, where with the changes, with the hormonal changes and what we call differentiation and characteristic, development of sex characteristics, you have an overgrowth of male or the breast that should involute or should go back, but when it doesn't go back, where it persists, then we develop the gynecomastia. Then we have another subset of patients who, especially after massive weight loss, massive weight gain and then more weight loss, they have a persistent of breast mold or breast mass in a certain population of men. And that is what our current patient is having. And that is a patient who had excess weight that has lost weight, and then you have persistent of breast tissue or breast mass. Most of the time the condition is not cancerous, and the preferred treatment is surgical because there's no drugs that one can take. There's no medication to take to cure it. So you have to go in and remove them using various surgical techniques. What we employ here at the AJ Plastic Surgery Center is what we call liposuction assisted excision. This is where you do the normal routine liposuction of the breast, because the breast tissue has fat, the gland and the skin. So you do, especially grade 1 and 2, liposuction, and then reduce the mass. Then we use a minimally invasive or just a small incision, less than a centimeters. You approach your breast tissue, you remove, and then you reconstruct. And with that, you expect recovery, full recovery, and a flat chest, because that is what most people would want. Such patients usually have very low self-esteem. You find that they cannot be shirtless, so they would fear swimming. Some sports like football, where you have to play shirtless, or just have a tight-fitting outfit, because that will reveal their feminine breast tissue. Recovery is quite smooth. We usually do it as a day case or an overnight stay. After that, there's compression garment that stays for about 6 weeks to 2 months, and then the healing is usually uneventful, with almost invisible scars around the areas. However, in men, whereby you find them, they have unilateral breast mass, that is breast on either side, right or left, with a normal chest wall on the other side, that it's very suspicious, and most of the time could be an indication of breast cancer, which as much as it's less common in men, it does appear. So anyone who has a breast swelling that is excessive on one side should actually seek medical attention.